This is the Children's Safety Network, and we are funded by the Health Resources and Services Administration of the U.S. Department of Health and Human Services. We are HRSA's primary vehicle for training and technical assistance on child safety topics, and nothing that's shared today should be inferred as the position or the endorsement of HRSA, HHS, or the U.S. government. Just some tech tips on accessibility and engagement. We do have closed captioning in the room that you can click using this CC button at the bottom. We do have a poll that's popped up. If you could let us know what type of organization you're coming in from. We will provide verbal descriptions and summaries as much as we can, especially of the chat messages. We will follow up materials such as recordings, handouts, and any transcriptions to meet or exceed our compliance guidance. In terms of engagement, we hope that you use the chat feature. I know that many of you have joined our STAWs in the past. So we do hope that you use the chat feature, a hand raise feature, and make comments throughout our session today so that we can make this the most fruitful session for you all. We do ask that you stay muted when you're not speaking, and if possible, and if you're in a place that you're able to, we hope that you would be able to turn your camera on when you're going to speak so that we can facilitate our engagement. But of course, we understand if you don't. And we are going to, we are recording the session and it will be publicly posted. And if you could please rename yourselves to include your state abbreviation and your full name, that would be lovely. We do try to see who's been joining us on different events to help us with our outreach. So thank you all. So we do have some community guidelines that I'd like to go over. We ask that during today's session that you focus on your intentional presence, bringing a curious stance, being partners in learning. We're all public health professionals here, and we want to honor each other's perspectives, experiences, and learning styles. And of course, you can take care of yourself as needed. So if you need to take a break, get up and shake out your wiggles, you are more than welcome to. So with that, I'd like to introduce our topic for today. It is improving prevention messaging with your workforce. If you've joined us in the past, over the past year, you'll have noticed that we've done a series on Quality Improvement 101, and this is the second Workforce Development State Technical Assistance webinar. We're focusing specifically on prevention messaging here today, and I'd like to explain how this all fits into our CSN framework. So the majority of the work that we do in the Children's Safety Network is in this inputs pie all the way on the left. So we work on child safety expertise, leadership and managing systems improvement. And if you're part of our Child Safety Learning Collaborative, you know that these are the main components. We hope that this leads to some outputs of workforce development and child safety system development. And so we're focused on this workforce development output in today's session of how do we work with our partners and with our folks on creating our messaging. Our ultimate outcome, of course, is positive health impact. And just as a reminder, and I know that many of you all are focused on health equity. Health equity underpins everything that we do in our framework. Great. All right. So our agenda for today is that we'll be looking at the playbook for developing suicide prevention communication campaigns from the CDC. We'll be doing a social ecological model activity with Lisa Hines. We'll look at some additional resources from the CDC and additional resources from CSN, and then we'll close out. And the mention of New York earlier got me into my New Yorker speed, so I do apologize for speaking very quickly. But without further ado, I will introduce to you Lisa Hines, who's the Associate Director for Communications for for Disease Control and Prevention's Division of Injury Prevention. She oversees the work for suicide prevention, traumatic brain injury, older adult falls, transportation, safety, drowning prevention, WISQARS, the Injury Control Research Centers, excuse me, and the Core State Injury Prevention Program. That was a mouthful, Lisa. So she's been working in health communication and education at the CDC for over 24 years, and she has a wealth of experience in communication science and strategy, product development, plain language, and project management. So welcome to Lisa, and thank you so much for joining us today. So I will hand it over to Lisa.
Great. Thank you so much, Maria. I'm really excited to be here today and to share this resource with you. I know if you're not familiar with CDC, I sit within the National Center for Injury Prevention and Control, kind of in the middle layer of that organization, which is one of the divisions. And our two sister divisions are overdose prevention and violence prevention. So just to orient you to kind of where I sit at CDC, you can tell by my other sister division names that they're very focused, overdose and violence. And we sort of have the umbrella of unintentional injury prevention, which is why there were so many topics listed in my bio that are in the purview of this division. But one of the things that we have been working on as a division since 2019 has been suicide prevention. There's been suicide prevention work going on at CDC longer than that, but the first official suicide prevention team actually formed at the end of 2019. So some days feels like a lot longer than that, and other days feels like it's hardly been a minute. But we've had a lot going on over those last 5 years, and communication has been a component of that from the very beginning. We've been able to contribute to our suicide prevention strategic plan for the division, as well as a lot of the other programmatic activity that they're working on. So today I'm going to be talking about this new tool that we've been working on for about a year. We're calling it the playbook for developing suicide prevention communication campaigns. Spoiler, unfortunately, it's not finished yet. We are still hoping to have it finished by the end of 2024. But if you have ever encountered the CDC clearance process, then you know that it's a bit of a gauntlet and timing is somewhat unpredictable. So we're in the middle of that process right now, but still hoping for a 2024 launch. CDC has been leading this effort, but we've had a lot of other input, which I'll share a little bit later, the organizations and the types of professionals that we've had involved. Next slide. So we know that communication capacity varies across public health organizations, whether they're community organizations, state or local health departments. In my time at CDC, I've been really fortunate to work with about 4 or 5 different state-based programs across a lot of different topics, and communication capacity varies tremendously. In some programs, there could be a full-time communications person. In others, there might be a project manager who's also trying to do communications as one of the many hats that they wear, and sort of everything in between. And so what we wanted to accomplish with this playbook was to provide a resource that would help people no matter what their level of expertise with communication is, because communication science, like a lot of other science, has a lot of steps. It's based on data, based on communication science, best practices, theories, models, testing, evaluation. There's a lot of components that can go into it. And if you don't have training in that area, like I would be out of my depth as an epidemiologist, it can seem overwhelming. And so that's why that was part of the impetus for this playbook. Next slide. So this playbook is meant to be a step-by-step guide to help you clarify your goals, define and understand your audience, and also develop and evaluate your campaign. And we're using communication campaign in a broad sense. We're thinking beyond communication campaigns that are focused on, just visiting a website or calling a phone number or a simple action like that directs people somewhere else. We're thinking kind of a little bit higher than that and a little more upstream when we're talking about communication in this capacity. Can you use your React button and give me a thumbs up if you have ever developed a communication campaign from beginning to end? All right, either no one's thumbs up works or that's a big no, which is great because
I
this is.
see we have about, if you look in the participant,
Oh, okay, perfect.
you'll see that we've got a couple of folks that are putting them up.
Okay, great. Well, then this resource is for you. So I'm glad that you're here and glad that I can share it with you. Next slide, please. You might be asking, like, why do we need a playbook for suicide prevention when there are a lot of other communication tools available? A couple of decisions went into creating this playbook. One is that a lot of the suicide prevention communication resources that are available, and there are some really, really good ones, focus on a component of communication, but not communication from beginning to end in terms of developing a campaign. And so piecing those together can be difficult if you're not really sure where to look for those or know that they're available. The other thing that happened is that last year, 2023, as the federal government was preparing for the National Strategy for Suicide Prevention and working on that, there was a group that was tasked to look across the government to see what the different agencies were doing in the realm of suicide prevention. And what we discovered was that there's a lot of activity happening, but once you dig into it, the quality and quantity varies quite a bit. Some of the activities were following communication best practices, some were not to a great extent. A lot of them were very broad, which is typical in public health because a lot of times we have limited funds and we try to reach as many people as we can. But suicide prevention has so many niche audiences that's really difficult to do, I think, in this particular topic. We also wanted to introduce communication more from an upstream perspective and working upstream in more protective factors rather than at the moment of crisis, which is where our colleagues at SAMHSA really exist in that space with the 988 number that they run and the services that they offer. The VA and DoD have a lot of really good resources and programs as well. And so what we also realized, we looked across sort of the quality of this material, was that we, as a public health organization and a group that has this suicide prevention expertise, want to kind of raise the bar on how we're doing communication about suicide prevention across the board. CDC will never be the trusted messenger for every audience that needs suicide prevention information, nor should we. You know, we'll never be as good at reaching veterans as the VA. We'll never be as credible reaching active duty military as the DoD is. And so if we're all sort of playing from the same handbook or playbook in this case, and using the best communication science, then we feel like we can raise the bar in what we're seeing in suicide prevention communication. So that's sort of the background for how we came to develop this. Next slide. So these are some of the sections that are going to be in the playbook, focusing on determining your audience. And there are some questions in there that try to drill down to very specific key audience and who you're going to be talking to, if it's that particular audience or someone who might influence that audience. For example, if you're thinking about teenagers, are you going to be talking to teenagers or are you going to be talking to parents and helping them talk to their teenagers? So there's a lot of questions that kind of help you drill down into who really is your primary audience. There's a lot of focus on developing a call to action and testing and evaluating a call to action in your messaging. And there's a component in there too about evaluation and sort of thinking about evaluation all the way through as you're building your campaign and what you can do at each step to think about how you're going to evaluate it. Next slide. So some of the key components that are part of the playbook that you'll see when we finally get it released are step-by-step descriptions and actions, and it walks you through kind of from beginning to end. Not that it's always a linear process, but we've laid it out in a stepwise fashion. There are considerations and suggestions, questions to answer either by yourself or with your team as you go through. We wanted to keep it as concise as possible, so we do have a lot of outside resources and references. As I mentioned earlier, there are some really great suicide prevention messaging documents and some more general evaluation resources. So we tried to link out to those that already exist rather than incorporate all that content into this playbook, just to keep it concise. The other thing that's going to come along with it is a supplemental workbook, which will just lay out all the questions that are in the playbook, but without all the context. So if you're going through the playbook, you can work through the questions one by one in the workbook if you want to, and have a place to document the decisions that you make. So those are some of the features that will be part of the playbook. So the workbook, as I mentioned, will walk you through some of these different pieces, how to segment your population, looking for data to support your choice so that you can make a data-driven decision. We did choose a focus on the social ecological model for this particular playbook and how to use that to reach your audience, along with, as I've mentioned, like dissemination and evaluation planning. Next slide. The other parts that we have included in the playbook are examples of how to use behavior change models like the health belief model and the social cognitive model are two that we've chosen. There's 4 in there total, I think, if I remember right. We also developed some personas to illustrate how to apply parts of those theories to a persona. We have a younger teenage persona, and then we have an older veteran persona as part of the playbook. And then at the end, we have a special section on considerations for using social media. And then we also have an appendix that talks about low, medium, and high cost options for some of the different steps that we talk through. So depending on what your budget is, you can see kind of what might be the most feasible for you in terms of strategy for each particular step. Next slide. So as I mentioned, CDC has been leading the effort, but we tried our best to have as much engagement from as much variety of organizations as we could. As you can see, we had quite a number of different federal agencies, including the Indian Health Service, our friends at SAMHSA and VA, and several others. We also had partners from the National Action Alliance for Suicide Prevention, as well as the American Academy of Pediatrics. Most of the people that were involved were, well, I'll talk about that in just a second, but we also had people who represented state health departments, communication specialists, and then also some suicide prevention specialists. So these were the types of people that were involved in the playbook. And the way that we did it was through a series of sprint groups. So we had a group that was focused on audience segmentation. We had a group that was focused on evaluation. We had a group that was focused on message development. And so those groups ran very quickly, and they were small, about 5 to 7 people. And then once they were finished, we sort of put it all together in the playbook. So that was the process for getting to the point that we're at now. Next slide. So we have a lot of volunteer experts from across many different disciplines, some of which I've mentioned. We had some people who have expertise in crisis communication, working with tribal audiences. We had health equity professionals. We had social media experts obviously contribute to our social media section. So we really tried as hard as we could to have representation from as many of these different disciplines as we could. And everyone who participated volunteered their time, which was fantastic. So we're really thankful for the folks that participated. Next slide. So as I mentioned, we're planning, I guess I should say planning, because there is a plan. It's not just a hope, to have this released by the end of 2024. It is one of CDC's deliverables in the new National Strategy for Suicide Prevention Federal Action Plan. So we're working hard to meet the deadline that we set forth for ourselves in there. It's primarily going to be an electronic document. So the main part of the playbook itself will be online, but the workbook will be a PDF that can be downloaded. So that's how we're planning to present it in this digital first age that we're living in. Next slide. If you're not part of our suicide prevention listserv, that is how we're planning to announce it, along with some other dissemination strategies, but you can be the first to know when it's released if you are interested in joining our listserv. It is used very judiciously, so you're not going to receive emails every day from us. So don't worry about the amount of content that you might get, but this will definitely be one of the places where we first announce the launch of the playbook. Next slide. If you have never signed up for a CDC newsletter, it's not as easy as it probably should be. So here are the steps that you'll encounter as you go through it. When you get to the site where you can sign up, you just type suicide prevention into the first box that you come to, and then just follow the prompts from there. But it's a multi-step process. I just wanted to lay that out for you. All right, so that's the end of my presentation before we hop into our activity, but I want to stop here and see if there are any questions before we move into the activity.
Yeah, thank you so much, Lisa. There was a question from Carol Harvey in Texas in the chat asking, are there components that address rural communities?
There's not a specific section or specific considerations for rural communities, but I think you'll find as you walk through the questions, if that's your audience, it will help guide you to hopefully the best choices for that audience.
Great, thank you. Any other questions for Lisa?
I just wanted to say that I think the comment Jenny made in the chat is really important, that it's amazing to have this resource specifically around suicide prevention, and so many of the messages and you know, this is a tool that could be used for other types of prevention and health promotion. It's very similar to a model that I've used for substance misuse prevention, and it's also, I think it's related to all the topics in CSLC. So I just wanted to kind of make sure that everybody felt like they were included and aware that this can be useful to them, whether or not they're working specifically on suicide prevention.
Yeah, thank you for that, Lauren. That's actually a question that I do get when I present and talk about the playbook, is can it be used for other areas of injury prevention? And the answer is yes, definitely. There's no special sauce about this particular playbook that makes it just specific to suicide prevention. The way that we've customized it to that topic is just by the examples that we've used. So the personas we've created, the situations they might find themselves in, how we demonstrate the use of the social ecological model, all of that content is geared towards suicide prevention, just to tie into the topic. But the steps, the models, the theories can be applied to any topic, really.
Great, thank you so much. Any other questions before we get started on the activity? Well, since we are talking about you did just mention the socioecological model, Lisa, I think that would be a great segue into our activity.
Sure. So in the chat somewhere, there is a worksheet that you can download that works through kind of thinking through a social ecological model for who your key audience might be. So I'm going to give everybody just a couple minutes to look at that and maybe think of a particular audience that you're interested in. And then what I thought we could do is kind of talk through what the different tiers of influence might be to maybe get you started thinking about how you could use this model.
Great, and we've color coded the tiers in the socio-ecological model. So the dark gray is tier 1, the green of relationships is tier 2, the blue is tier 3, and the red is tier 4.
And the example that we have in the worksheet is one of the personas that we have in the playbook, which is a 17-year-old high school student. I will tell you that this is an early early version of the persona. We have made a couple changes to the tier 4 examples, which I can share with you as well if we get to talking about that particular tier. That's probably one of the harder ones to influence with a communication campaign. I think most people will probably be in the tier 1, 2, or 3. But we wanted to include examples for that tier 4 just to have the complete model. I'll give everybody a second just to think if you want to print out the worksheet or fill it out online. And then I'm going to ask for a couple of brave volunteers. All right, does anyone want to share who their tier 1 group is? All right, well, I'll give you a little bit more time to think and we can talk through the example about Danica if you want. I can share some thoughts about how I would approach a student like her, a young girl who the mid-level teenager, I guess, late teenager, who is in high school and thinking about maybe the next steps in life. So, communication campaign that was focused specifically on Danica would know her habits, would know how she receives communication information. I'm going to assume most teenagers at some sort of social media. There might be other channels, more local channels that she engages with. So there's opportunities to reach her directly with messaging about suicide prevention, even protective messaging about, staying connected to your friends in real life or IRL if you have some teenagers. The importance of connection to your community, whether it's your church or your school or an organization that you might be engaged with outside of school. So there's messaging I think that you can think about that's a little bit more upstream about keeping healthy relationships in your life, looking for support when you run into problems. along with a lot of the crisis messaging that we see a lot of now geared toward teenagers about texting or chatting with 988, going to a school counselor if they're feeling sad or depressed. So kind of depending on where you want to intervene in that sort of continuum, will help you decide what your message is going to be.
Lisa, I think I saw Jeannie unmute for a second. I
Oh,
don't know,
perfect.
Jeannie, if you were going to share something and we cut you off.
Well, I was going to offer up a group.
Perfect.
Just from my own personal experience, what we did here was it was very specific for parents, caregivers that had children ages probably 10 and under. When our child passenger safety law passed, we had to educate parents. Not only that, but as we kind of went through understanding like who else was affected by this law, it was also law enforcement, childcare providers. So there were a lot of other groups, schools, because they were transporting children under 8, in various ways, whether it's in a van or a school bus. And so there were a lot of then secondary kind of audiences that we kind of knew, but then there's a lot that kind of popped out of the woodwork that we had to like make sure that we addressed getting them educated so that they could properly transport children according to our law in their situation. So it became a lot of different people, tier 1 or
I think you mentioned people in tier 1, 2, and 3.
Yeah.
Example, pediatricians who might talk to parents directly, law enforcement who might offer a car seat safety check or pull over someone who they notice doesn't have their child in a safety seat correctly. So yeah, I think you had some great examples.
Jeannie, you just brought up such a great example, though, about, again, public health, the complex system, and that, while it's clear who your target audience is, you're working with Danica, that, immediately you are already expanding your focus and thinking about all of these other players that are involved. And what I appreciate about what Lisa is saying is the opportunity, just like we do with our quality improvement work, is to take that step back and to really break it down, separate those different tiers, even though they're all interacting and you have to attend to all of them, like we encourage working across the socioecological model. It's also important to really step back and understand, where you can refine some of that messaging for each of those tiers and then get them also interacting in a holistic campaign. So this playbook really helps you to, do that and take that step back and think about the separation and yet also the integration.
One of the things too that we've woven into the playbook is trying to really drive home the concept that this is not meant to be a standalone effort. And I'm sure you all working in health departments and other public health organizations very rarely work in a vacuum. And there are community partners, there are other organizations, churches, schools, places like that that are already doing work in suicide prevention or in child passenger safety. And they may already be addressing a community level audience. So you may not have to take that part on. Part of what we try to do in the early part of the playbook is really identify like what is your niche? What is no one else doing that you can contribute to the fabric of what is going on around suicide prevention or any other topic? And how can you complement that to add another component to it?
Well, and just from being in the CSLC for so long, working with your audience that you're trying to get the message to. We had parents go over our materials and tell us what sounded right, that didn't sound right. And I mean, we had then, we had a marketing company that helped us develop all types of different media so we can reach people wherever we thought they were at. And so it really helped to define kind of our message, or I should say refine it, because we had parents that were going to eventually hopefully receive the materials, provide feedback on those materials.
Yeah, and Claire, I saw your note in here too. You're right on point, and we addressed that in the playbook. We use a slightly different terminology, but we have campaign beneficiary, which in this case would be Danica. So she's the person we're really trying to reach, but for whatever reason, maybe we can't get to her directly, but we can access her parents, or we can access her youth pastor at church or temple. And that may be our campaign audience, because that's who we're going to talk to, but the beneficiary is still going to be Danica. So I think that's similar to what you were talking about with population of focus and agents of change. Thank
Great.
you for your example, Jean.
And I did see Jenny from New Jersey also unmute for a second. Was there something you wanted to share?
I don't think I unmuted, but
Oh,
hello.
I'm sorry.
It's okay.
You and Jeannie and Jenny are on top of each other on my screen, so maybe I
am also excited about the playbook, and I'm gonna have to figure, like, if you put out the QR code again, that would be fantastic.
Oh,
Or
sure,
put
no problem.
that maybe. I tried to do it through my phone, but it wanted to sign me up on my personal email, and I want to sign up with my work email. So if there's an actual link and you could put that in the chat, that would be fantastic. Thanks.
Sure, I can absolutely do that. It's also in the slide deck. So when you get the slide deck, there is a link in there, but I'll put it in the
Great,
chat.
thank you.
Yeah,
And I did see a comment in the chat also from Melissa about anxiously awaiting this playbook. So I don't know, Melissa, if you had any questions or comments, any thoughts about who you would be talking to in your communication campaign.
No, yeah, I was just saying, like, I'm excited that it's coming out soon, because I know CDC's been working on it for a while. And I feel like specifically for us with our rural populations, it'd be a really good guide. And I'm excited to see like the workbook as well to help us with our communications.
great, thank you. Yeah, we talked about it a little bit at the reverse site visit that was recently, and Safe States, which is where I met Maria in September, was the first time that we kind of put it out into the world and started talking about it. So it's exciting for us to see, the excitement that it's generating in the field.
So I have an example. Oh, Jenny, go ahead. I'm just thinking through the example that Jeannie shared about the child passenger safety and how we would communicate across all of these tiers for compliance on child passenger safety. I, for example, am very strict about having my own children in child passenger seats and making sure that they don't get into other vehicles without the appropriate seat. But then I also put my child on a school bus that has no restraints whatsoever. And my child has also come back to me and said, well, why do I need to use a seat in the car when I get on the school bus and I don't even have to put on a seatbelt? So I'm wondering about like all of those levels. Like there's the individual, like obviously my son would be the beneficiary, but it's going all the way up. Yes, and I see a comment, school bus seats designed differently. So
I think would fit probably in the tier 4, the society sort of category, where you'd be looking at maybe legislation around school bus design, or working with school bus manufacturers from the sort of the top down in making school buses safer. It is kind of mind-boggling that school don't have feedback.
Yes, like I can't drive to school without my child being in a child passenger seat, but he can get on the school bus and
Let's put 50 of them in one vehicle and
yes.
a little disconcerting.
But I know I gave a more societal example of what
Sure.
Jeannie was talking about. So
What about others that are already working in suicide prevention? What kind of communication are you working on now, and how might it fit into the sort of social ecological model?
I can unmute for. So we're New Jersey is a GLS a grantee, and we're in our 5th year. It's been a great 4 years. We actually are market testing right now a suicide prevention and awareness campaign that is for youth by youth. And so we formed a youth planning committee a couple of years ago, and that group sort of met and did a lot of in-person events. We have summits twice a year. And then they just started kind of gathering their membership over the summer. We hired a media company that is an all Latina female run media company. We were really excited about that. And they helped a group, our YPC group. Basically, they went through education on safe messaging and all sorts of things. And then they, together with Netta Collab, worked on a campaign, and we are now market testing that campaign. And so when I think about this, you know, I think for, oh, thank you, Jenny. Like, yeah, Garrett Lee Smith, he's suicide prevention. Yeah, it's a long one. But thank you for that. And so when I think about this, you know, playbook, I really think about the aspect of really utilizing your community. You know, we say a lot of stuff, nothing about them without them. You know, when I finally saw the product of their work, I was just so floored because, you know, I think that as adults, we have perceptions about young people, and for that matter, any perceptions about any population and what they would like or what they would want to see. And it was so different than what I would have envisioned that they came up with. But I just think that that's really fantastic, because what it becomes is authentic. And we have such a better way of now reaching those young people. They're doing this great thing that I think is that they're having these mental health fit checks. So young people can submit videos that will then be on our social media that will do things like say, like, what helps me support my mental health is X, Y, or Z. And my daughter did one. She's 17, and we had an event at a farm just last week. And I was just watching her. I thought that her mental health, it was all about her Uggs. And how when she's having a really bad day, she puts her Uggs on because they make her feet warm and cozy, and then the warm and cozy goes up through the rest of her body. And like eventually it gets to her brain, and then she doesn't feel so bad. And so I feel like I just really love the idea of, right, when we do something, it's nothing about them without them, right? Whatever population you're working with, not including their voice in the work that you're doing is just such a miss. And but yep, or a hoodie or a whatever. But I just really I love the stuff that they came up with. There's one piece of the campaign that's like your mental health is a priority. And there's another one that's about like your mental health is as much of a priority as your GPA. Like they were very focused on wanting to send the message that you should not be putting your academics and your GPA above your mental health. And so I'm just really proud of the work that they've done, and I'm excited for once like everything is like going and we can kind of share it out a little bit more. Then
I would love to see it. That sounds great.
So I loved everything that you shared, and I thought it was like it's always nice when like you hear stuff and it's best practices and it's coming from the CDC, and then you're like, okay, you know, like I know that we're doing our due diligence and we're doing the work that we need to provide our community and specifically youth in our case with messages that are crafted by other youth and that are specifically speaking to them. So I would say that's what
Great.
I would share that fits in with what you presented today.
Thank you.
Yeah, I think that really speaks to like culturally responsive and respectful messaging also, like not just thinking about distinct cultures, but also thinking about like youth and adolescence as a culture that we need to incorporate. And I would love to hear examples of incorporating youth voice, or even Jenny elaborated more on maybe even across the tiers of how you've included parents or other levels of the socioecological model in creating your communication.
Yeah, so there are a lot of levels in our summer program and our youth campaign. We had a social worker, a licensed clinical social worker, and all of the 8-week program that we had over the summer. All the parents parents and caregivers were contacted before, and we did interviews with them afterwards, and we evaluated it. So we actually did pre and post surveys of the youth, and so I feel like, you know, part of that in being like being a GLS grantee gives us that ability to evaluate this work that we're doing. And so we're not just doing it, but we're also really looking closely at what are some of those best practices that need to be included when you're working with specific populations to make sure that they're safe and they're protected, and that their parents and caregivers are a part of the conversation. And I think that was, you know, a really well done on the part of our sub-awardee that did the work.
Great. Thank you so much, Jenny. And I see some comments. Heather has shared a link to NHTSA's school bus safety bus stops drivers webpage. So thank you so much, Heather, for sharing that. I've gotten some personal messages to ease my mind about school bus safety. So thank you also as a parent. Thank you. And I do appreciate you all sharing your examples. Lisa, do we have do we have a few more minutes for our discussion, or do you want to go on to your
My
research?
last couple slides will just take a couple minutes. So,
Great.
you know, if there's more conversation to be had.
Perfect.
I like, Jenny, your comment about your team feeling connected to survivors and them telling stories. And one of the things we know about suicide prevention is how important stories of hope and resilience and survivorship can be really powerful ways to connect with people emotionally, to have them think about and pay attention to the messaging.
And I also think some of the point of my comment was also that sometimes messaging isn't just words. So sometimes, you know, you need to think about other ways that you can build that communication to the, you know, there was a big promotion of the butterfly years ago, you know, in part of these survivor stories and the transformation and, you know, being, you know, resilient and then helping others to find their own resiliency. And so just, you know, wearing the butterfly became an immediate symbol of, hey, I'm an ally, I'm safe, I've been there, I've done that, whatever it might be. And it really helped to reinforce the community of resilience. So those are just, I mean, again, across topics to think about. It's not necessarily just creating ads and you know, written communication, cards, whatever. You have to really think, and it goes back to Jenny's comment, not for us, without us, that, you know, utilizing the feedback from sectors. It doesn't have to be a lot. Jeannie Beats knows, right? You can use, you know, 4 or 5 people, parents, for example, to read an informational card you want to share, and get their feedback on, like, no, this doesn't make any sense. It's a bunch of jargon, or, you know, I would throw this away, or whatever, to help you to adapt what you're doing and make it more amenable to who you want to target.
Great. Thank you all. So I will share the slides again. So Lisa can share some more CDC programs and resources.
You can go ahead and flip to the next slide. I just wanted to make sure that everyone knew about these programs. It may be old news to you all, but because there was such a variety of topics that are represented by this group, I just wanted to make sure that I could connect dots if I could. So as I mentioned, we have a comprehensive suicide prevention program that my division funds. The states in purple and the county in Puerto Rico are the current grantees. I think there's 24 right now. And they're doing community-based work on suicide prevention. So as I was talking about weaving your communication work into existing efforts, that's what a lot of these states are doing with state coalitions or county coalitions and county partnerships and state partnerships. So we have this program. If there's one in your state and you don't know about it and you want to get connected, just email me and let me know, and I'll put you in touch with the principal investigator or the project manager there. Next slide. We also fund universities. Right now we have 11 that we fund called Injury Control Research Centers. You can see with the little colored teardrops where we have universities that we fund. So they're doing work across a variety of injury prevention topics, including ACEs, TBI, suicide prevention, and a lot of others. So if you're interested in connecting with one that might be in your area or your region, just reach out and let me know, and I'll be happy to put you in touch with them. Next slide. We also fund a program called the Core State Injury Prevention Program. The states that are in purple here are the states that are currently funded. This program has been around for quite a while. It's had a couple of different names, but it's always been called Core something. So the current iteration is State Injury Prevention Program. These are states that are working across injury topics. Again, many of you may already be familiar with them since you're doing injury prevention work in your state, but just in case, wanted to make sure that everyone knew about these. And then I think there might be one more. As a disclaimer, this is not my area, but I know that you all are working on safe sleep. And so I found this current grantee map from my colleagues in the National Center for Birth Defects and Developmental Disabilities. So these are states and sites that they fund to do safe sleep work. I think that might be all. And then here are some websites that CDC has related to many of your topics. I threw in drowning prevention just because it's one of the topics in our division and also affects young children. They're at highest risk. So I wanted to make sure you knew about that. We have a lot of child passenger safety information. We have some really great teen driver resources. And then a couple of other resources about bullying prevention that CDC has. So just wanted to make sure everyone kind of knew about those. It might be old news, but I thought it was worth trying to connect all the dots there about the resources and grant programs that we have. Oh, good. Adding water safety. Perfect. To your next cohort. That's great. I'm happy to take any final questions.
Great. Thank you so much, Lisa. And please go ahead and continue adding any questions or comments in the chat. I have a few final tidbits that I'd love to share with you all. And yes, we are adding water safety and drowning prevention in the next cohort of the CSLC. That will start in June of 2025. We will be sending out applications in February of 2025, so just a couple months away. Shocking to think of 2025 as being only 2 months away, but here we are. So thank you, Lisa, for a wonderful presentation and thinking through all of these communication strategies. I'd like to also show a few things. I know a number of you are in our CSLC, but I also see some new names. So thank you all for joining us. We are here to help. So if you we have a ton of resources on our website. If you need to reach out to us for technical assistance, please feel free to do so. We did refer to our change packages, and there are some comprehensive change packages on our website on a number of injury prevention topics, including interpersonal violence, falls prevention, child passenger safety, teen driver safety, suicide prevention, bullying prevention. We have a whole slew. Thanks, Jenny, for putting in the website in the chat. So please feel free to look through our resources and reach out to us at any time. For those of you who are in the CSLC, I think that this is a really awesome complement to the work that we're doing in the Learning Collaborative and thinking through all of the different tiers of the socioecological model and how we're best addressing our strategies, our change ideas, and our measures. So please feel free to reach out to us for technical assistance at any time. We would love to hear from you all about what questions you still have and any questions that you would like to know more about. We try to be as responsive as possible to the needs of the states that we're working with in the CSLC and general technical assistance questions that we receive from the public. So we would love to hear more from you. Jenny has put in the evaluation for today's call in the chat. So we do hope that you'll take a minute to give us some feedback about today's webinar. And we would love to hear more about what types of topics, what types of technical assistance you would like so that we can tailor our next webinars around the needs that you're seeing in your work. So thank you all. And I apologize again for my speediness. I don't know what's going on with me today. Melissa, I'll blame you for mentioning New York, but it is all New York. I'm still swallowing my accent, but the speed is New York. So please feel free to fill out our brief questionnaire and contact us at any time. And I thank you again, Lisa, for sharing this with us. And we do hope to be able to share it out with you once it's approved and posted publicly. We will share it out with our states as well. So thank you, Lisa, for joining us. And we hope that everyone has a safe holiday season ahead. And we will see you soon. So thank you all. Have a wonderful afternoon.
Thank you.
Thanks, everyone. Bye.